I think the real unique selling point or unique value of this study is that it addresses a very critical public health problem, which is the youth mental health crisis, the increased rates of mood disorders in young people. But it does it through technology by methods that really attack this problem through understanding basic mechanisms. So what is it that's going to be helpful and how does it work? And doing it at scale so that the results are both generalizable across large populations and across different countries, and demonstrating a methodology which I think could really be harnessed and replicated in future studies. Yeah, I think it's a really important point because, as you're aware, there are many thousands of apps, particularly in the that have been released for mental health purposes, but very few of them at all have an evidence base behind them. Some claim to be derived from CBT principles, but there is a desperate need for a strong evidence base, but also to understand the components, the active components. And ECoWeB was beautifully designed to be able to address particular questions in terms of mechanisms of how these interventions were working, both in a preventative model and also for active symptoms. And I think that this has really set an exemplar of how studies like this can be run. And I think the collaboration across European countries is incredibly important, has been more challenging in recent years, but also the way of running a study in the pandemic has again demonstrated that in incredibly challenging conditions that research trials of this type can be run at scale that will give important and meaningful results. And this is really an order of magnitude greater than for sort of traditional behavioral therapy studies that may recruit hundreds into a trial. Here we have thousands, and that allows you to answer really quite different questions around components and do comparisons and move towards a model potentially of personalization and adaptation, which just isn't possible with smaller, more traditional trials. I think the results are important. I think they perhaps won't be translated immediately into a specific product, but I think the component findings around what works and what works for who will be of value to those who develop new products. But I think the second point is that it's an exemplar for methods really, that and showing that studies of this type are feasible, and again, in very challenging conditions can be run, and that will really up the game, I think, in terms of the scale of research, particularly the type of size of sample. We talked about thousands, that it's possible to recruit young people, and also possible to recruit young people who can be retained and adhere to the interventions for a sustained period of time. I think there's a lot of skepticism about that before this study, and I think that is a major finding.